Today we're going to be talking about diabetes and the oral systemic link. First, we'll start by defining periodontal disease as a common but avoidable oral disease that is caused by plaque in the gingival sulcus, leading to an inflammatory response. The result is chronic, irreversible destruction of soft and hard tissues of the oral cavity, as well as permanent bone loss. This can lead to tooth mobility and eventual tooth loss. Many risk factors for periodontal disease and systemic chronic conditions are the same. Smoking and poor diet are common indicators for both, leading to chronic inflammatory responses that limit the body's ability to provide homeostasis in other areas. In other words, the existence of one or the other could exacerbate either condition. There are two types of diabetes. Type 1 is a chronic autoimmune disease that attacks the cells that create insulin required to regulate blood glucose levels. Patients with type 1 diabetes are therefore required to take insulin daily, typically by injection, to manage blood sugar. Type 1 diabetes is usually diagnosed in childhood and is irreversible.
Type 2 diabetes is characterized by a decreased response of target tissues to normal levels of insulin, requiring increased levels of insulin for an adequate response. Type 2 diabetes is associated with excess weight, physical activity, family history of diabetes, and certain ethnicities, which makes up about 85 to 90% of diabetic patients. This type can be preventable through the daily lifestyle. Obesity is defined as excessive body fat in proportion to lean body mass, to an extent that overall health is impaired. Obesity is considered as a large-scale public health dilemma. It is linked to the evolution of obesity-related disorders, including metabolic syndrome, type 2 diabetes, insulin resistance, dyslipidemia, and cardiovascular diseases. The relationship between diabetes and periodontal disease is often described as bacteria associated with periodontal diseases that cause chronic inflammation that can in turn damage the pancreas where insulin is produced, potentially causing diabetes. Diabetes worsens oral health by increasing harmful bacteria that is present.
Statistically, as periodontal disease progresses from mild to severe, healthy patients are least affected. Periodontal disease affects up to 42% of adults in the U.S., and people with periodontitis are more likely to develop type 2 diabetes, as indicated in the chart to the left. Many diabetic patients taking medications are at risk for xerostomia. Without adequate salivary flow, the oral cavity becomes highly susceptible to periodontal disease. Healthcare providers and dental professionals have the opportunity to work in collaboration to improve the health of patients with diabetes and periodontal diseases by understanding how they lend to each other. Physicians should be screening at yearly appointments, screening oral health and asking about any oral discomfort, providing patients with resources such as pamphlets and websites, and referring them to their general dentist.